Hi, my name is Dr. Kevin King. I'm a resident physician in the Department of Radiation Oncology at Rush University Medical Center. Metastatic cancer is when your original cancer moves to different parts of your body. Historically, we viewed this process as kind of an all-or-none type process where once it moved elsewhere, the real treatment is systemic therapies like chemotherapy, immunotherapy, and different targeted agents. However, in 1995, they coined the term oligometastatic disease, meaning that your cancer has moved to only a few different spots throughout your body. It hasn't moved throughout your entire body. We found that we can use different targeted therapies like radiation and surgery to target these few lesions. A lot of people choose to go with radiation therapy as they don't want to go through another invasive procedure, and that's why patients come to us. Oligometastatic disease is diagnosed just by how most cancers are diagnosed. That's why it's really important to follow up with your primary care provider. Things like routine imaging, an abnormal lab result, or something on your physical exam like a new lump or bump or pain somewhere that is new for you. Oligometastatic disease is most common in the types of cancer that are most likely metastasized in general. These would include lung, breast, prostate, and colorectal cancer. Rush treats oligometastatic disease a few ways. First, we focus on you. We have a dedicated team of medical oncologists, surgical oncologists, and radiation oncologists like myself that will come together to specifically discuss your case and determine what treatment option is best for you. Then you'll see us in consultation where we'll be able to figure out where exactly we need to treat. Sometimes these treatments can range from a single fraction or a single treatment all the way up to 5 treatments, but overall reducing the treatment time that would be required for something like this. We work closely with our medical oncologists for people who have metastatic disease to evaluate if they would benefit from SBRT as well. One of the ways that they might benefit is for those patients with oligoprogressive disease. Oligoprogressive disease is similar to oligometastatic disease in the sense that it is for patients who have metastatic cancer. But in oligoprogressive disease, these patients are usually responding well to their chemotherapy except for a few spots that might be growing through their treatment. We can then use SBRT to treat some of those few lesions that are deemed oligoprogressive. The first thing that we do when you come in to receive radiation therapy is we sit down with you in a consultation and discuss with you what your current problems might be. From there, we'll have you come back for something called a CT simulation. This is a mapping session for us where we take a CT scan of your body to figure out a plan specifically based off of your anatomy. That process usually takes us about a week, and then you'll come back for your radiation treatment. Like I said earlier, SBRT and something called SRS, which is stereotactic radiosurgery, can be between 1 and 5 treatments. You'll meet with a provider like myself weekly just to sit down and see how the treatment is going and if we can help in any way. Radiation is something that you can't see, feel, taste, smell, hear, so you won't be able to feel it at all. The radiation doesn't actually work immediately. It takes a little bit of time, so we will order re-imaging scans at your next follow-up visit, and that's the time that we'll really see the effect that the radiation had. We always strongly encourage you to get a second opinion regarding your cancer care. Here at Rush, we have disease site specialists that only treat that specific disease site. You can see them in in-person consultation or via teleconference. We will always like you to be seen in person so we can do a thorough physical exam, but we're accommodating to whatever needs you might have.